I'm not gonna lie to you, when I first heard of Clearhealth, I thought it was a scam. But 5 months later, I now have the best skin of my life. Let's talk about it. So let me give you a little bit of background. My name is Kelly. I am 24 years old and I've had persistent treatment-resistant acne for about 12 years of my life. I've tried everything under the sun from topicals to oral medications to help combat my acne, but nothing really worked. So I decided to bite the bullet late 2022 and start my Accutane journey. That's when I was looking online and found Clearhealth, and the reason why I found Clearhealth to begin with was because I do not have insurance. I am a freelance private chef, so therefore I do not have health insurance. I wanted something that gave me the accessibility to pay out of pocket without causing a huge dent in my wallet. So that's why we landed on Clearhealth. I'm not gonna lie to you, in the very beginning, I was a little nervous about starting Accutane. And the reason for that is because when I was doing my online research, as one does, I saw a ton of personal recounts of bad experiences, very bad side effects, and I mean, it's a pretty invasive drug. We'll talk about that, but honestly, I'm so grateful that I did it. As you can tell now, it's looking really, really good, and I don't regret starting Accutane at all. I was determined to have a very smooth treatment process, so before I started during my waiting period, which we'll get to in a little bit, I was doing a ton of research online about the best skincare, the best practices, what an ideal diet should be, all the things to ensure that I have the smoothest treatment possible. And that's exactly what we're gonna go over today. So today, we're gonna be talking about the pill and the basic mechanisms of how Accutane works, the prescription process through Clearhealth for both men and women, common side effects as well as my personal side effects, essential skincare and diet, and closing thoughts that I have as a previous patient. Let's get into it. Please note that I am not a dermatologist, I am a past patient with Clearhealth. All of these are my personal experiences. These are not recommendations from a doctor. If you are experiencing any adverse side effects or concerns or have questions, please contact your personal dermatologist for next steps. So let's start with the basics of the pill itself. Accutane is the brand name for isotretinoin, which is a fat-soluble derivative of vitamin A. It reduces the amount of sebum that your skin produces, decreases inflammation, and helps your skin renew more quickly. It's usually taken as a pill orally once or twice a day depending on your dosage for a handful of months, depending on what your dermatologist recommends. I personally only had to take it for about 5 months, but I know that some people have 6 months, some people have 8 months, some people might even have 3 to 4 months. It really just depends on the severity of your skin and how you personally are tolerating the medication. And of course, isotretinoin is typically used as a treatment for moderate to severe and persistent acne, especially when the skin doesn't respond to other types of medications. Let's talk about the actual prescription process through Clearhealth. So big disclaimer, I am a female and I'll be talking about this through the lens of a female because there are a couple of different steps that females versus males have to take in order to get prescribed Accutane. I will note where the differences are, but just take that into consideration. So to start, I initially expressed interest as someone who wanted to be considered for Accutane. I took my first pregnancy test and then I had to wait a total of 30 days between that and when I could actually get my first medication to start the process. And the reason for that is because of iPledge. iPledge is a mandatory risk management system in the US that is designed to prevent pregnancy and ensure the safe use of Accutane in women of childbearing potential. There are very aggressive side effects that are known to happen if you are a woman taking Accutane while pregnant. So that's why it exists. That also means that every month before you get your next prescription, you have to go in and sign the iPledge again and do the iPledge questionnaire to make sure that you are still willing and able to take it while assuming the responsibility of a childbearing woman. So the timeline so far is express interest in Accutane, take my first pregnancy test, wait 30 days, take another pregnancy test, take the iPledge again, as you do every month, and then you get prescribed and sent your medication. I'm gonna reiterate one more time, that does not happen for men. If you are a man and you are not of childbearing abilities, then you can immediately just get your first medication. That is just the way it is for women. It's for our own safety, it's for the safety of future generations. That's just the way it is. So bear that in mind. So at this point, you've been approved for Accutane. How do you get the actual pill? So we have a couple of options. The great thing about Clearhealth is that they can ship it to you directly to your door from one of their in-house pharmacies if you choose to pay out of pocket, which is what I chose to do. Alternatively, if you choose to pay with insurance, you can have them send the script to one of your local pharmacies and pick it up from there. So you have two options that are equally as convenient for whatever situation you are in. Now let's talk about monthly obligations. Because Accutane is a pretty intense drug, you do have to do a couple of things for monthly obligations, which includes monthly pregnancy tests if you are a woman, the follow-up visit with your dermatologist for monitoring progress and side effects, as well as one blood test that's typically done on the second month of treatment. Now traditionally with other dermatologists, you'll have to do monthly blood tests, but the Clearhealth method is the least invasive, only doing it once after the second month of therapy, because that is the most indicative of any sort of problems that might happen. And then of course, if your results come back normal, you won't be asked to do it again, which bodes well for me because I don't love needles. I don't love getting my blood drawn, so only having to do it once as per the doctor's instructions is perfect for me. So at this point, you've already been okay to start Accutane. You already have the first month's pill. At this point, let's talk about what best practices are that I found for my personal journey. So let's first start off with skincare. So big picture, think about it like this, right? Your skin's gonna be pretty dry. Your lips are gonna be pretty dry. Everything is gonna be changing about your skin. So you really want to be careful about what you put on your skin and prioritize hydration and sun protection because again, your skin's gonna be really sensitive and dry. So prioritizing a sunscreen with at least SPF 30, as well as a lightweight, fragrance-free moisturizer. I'll leave a couple that I personally recommend on the screen right here so you can purchase them. So the bread and butter of my skincare was sunscreen during the day, a light moisturizer at night. Everything else is auxiliary. For cleansing, I primarily only cleansed my face at night with a cleanser. In the morning, I would start off the day by just splashing some water on my face and calling it a day before following it up with my SPF. But for cleanser, you want to use, again, something that's fragrance-free and mild. These are some that I personally use and recommend. And then the last thing that I really recommend for everybody to have is some sort of petroleum jelly-based product to help not only with your lips, but also locking all the moisture in on your face. I'm a big fan of Aquaphor. Aquaphor is readily available here in the US. I used it simultaneously on my skin after moisturizing as well as my lips, because my lips were very, very dry. I still have a giant tube about this big that I'm still working on from my Accutane days, and it's great for lips and it's great for skin. So I really highly recommend that. Those are some general skincare tips that I would recommend, but we also need to talk about the skincare tips that I would actively avoid. So again, thinking big picture, right? A ton is happening to your skin, so you don't wanna add more stuff into the mix with regards to your skin. So the big things are anything that's heavily fragranced because that contains a lot of alcohol, anything with other actives such as vitamin C or exfoliants, both chemical and physical exfoliants, anything where you have to scrub or any sort of AHA or BHA because that can be too much happening at once to your skin. And any sort of other acne treatments. So think salicylic acids, things like that, don't use them. It's gonna be too much and it's just gonna do more damage than good. So again, big picture, think hydrating, think emollient, think non-cosmogenic, think light, and you'll be good. The next thing we need to talk about is diet. So when I'm talking about diet, I'm not really talking about an entire change to everything that you eat, but I have found that the pill seems to respond better in my body whenever I have any sort of snack that's high in fats prior to taking it, maybe 30 minutes before taking it. And the reason for that is because Accutane is a fat-soluble drug. So what does that mean? If there's some sort of fat in your stomach already, it's going to dissolve better into your body. You're spending all this time and energy and effort and money to take Accutane, you might as well take it correctly and have it yield the best results as possible, right? So there are some foods that I always kept in my home in order to take a quick snack before I took it to ensure the best results. And the main things that I kept in my home were any sort of nut. So my favorites are cashews or macadamia nuts. Also kept some peanut butter. So maybe a spoonful of peanut butter before I take it, that would do the trick. If I took it during breakfast time, I would always keep some sort of salmon, whether it's smoked salmon or fresh salmon to cook up before eating it, or avocados. About half or a full avocado before taking your medication is also very helpful. So those are the 4 main foods that I kept around. But if any of those don't work for you, I would also consider this list of foods that are all high fat and great supplements to your Accutane medication. Here are the really common side effects that could happen, and the reason why we're considering all of this to begin with. Accutane has a lot of stigma about the side effects that could happen to you while you're taking it. So doing all of these are to alleviate as much as you can for what the side effects could be. Of course, that depends heavily from person to person. I personally did not have super severe side effects, which I'm really, really grateful for. But let's talk about some of the really common side effects that one can experience. The most common side effects that would happen to you and happened to me were overall dry skin, overall dry lips, and then in the beginning, I had a pretty dry scalp. It wasn't awful, but I did have consistent dandruff for a long time. But the great part was I only had to wash my hair about once a week because I had no oils on my body. So that was pretty nice. So just like general dryness, right? Like my body needed moisturizing, my skin constantly needed moisturizing, my lips constantly had Aquaphor on them, but it was very tolerable. I was also pretty sensitive to the sun because of course your skin is just thinner and more sensitive overall. So skincare and SPF was super important to me, and those were my main side effects. Now I've put on the screen some more serious side effects that can happen, but are very rare to happen. If any of these describe your current side effects, I would strongly suggest you talk to your dermatologist about your side effects. But aside from that, you're set for your first month of Accutane. It's gonna be fun. So let's talk about some closing thoughts. Do I regret doing Accutane? Absolutely not. In fact, I kind of wish that I did it earlier because I spent so many years of my life just wishing that I didn't have acne and waiting for opportunities to become available to me because I was inundated with acne and it played such a big part in my self-esteem and self-confidence, which ironically includes video production and making content and being a YouTuber. So that just goes to say my personal experience was very good, it was very tolerable. It was kind of annoying to take 2 pills a day for months, but it wasn't bad at all. I tell my friends all the time that I had objectively a very, very normal case of Accutane. Overall, I have a ton more self-confidence and allowed myself to go through these doors that I feel like I wasn't able to before based on my own predispositions of, oh, my skin's not clear enough to do that yet, which again, ironically includes content creation, which includes being a social media influencer and being a YouTuber. So that's the irony. I honestly wish that I did it earlier. So that's the video. I wish somebody had made this video for me when I first started Accutane so I didn't have to scour the internet for all of these tidbits of information. And I hope that this is helpful for you. If you have any additional questions about Accutane, the Clearhealth experience, your Accutane journey, or any other side effects, please leave them down in the comments below and I will try my best to get to them. And I'll see you guys next week for another Accutane related video. Bye guys.